sleep quality, stress management. And I also found myself to de-prescribe more than prescribe. So if I had a patient coming to my office, I found myself going over the list of their medications. A lot of patients came to me with 10, 15 different medications that every specialist put them on a different medication without knowing what else they're taking, right? So I would go over the list and see if there was a medication that the patient was really not getting any benefits from it, probably some side effects. So I would safely, but very gladly, remove that medication from the list. And it was very difficult to prescribe a new medication unless I had to. So that's when I got to know functional medicine. And once I got to know functional medicine, that just completely changed how I look at life and how I look at health. So with functional medicine, we just approach the disease a little bit differently, and we just ask different questions, right? And we can go next slide. With a show of hands, how many of you guys think that our current healthcare system focuses on symptom management rather than finding the root cause? Yeah, I see a lot of hands going up. Have you ever heard the word functional medicine? Anyone? Okay. What is functional medicine? How the body works? Mm-hmm. Take care of the problems without taking meds. Right. Yeah. One time I asked this question, and a gentleman in the crowd said, "Well, I know it's not dysfunctional." I said, "Yeah, that's right." Functional medicine is actually very simple. So if I had to compare conventional medicine, the typical medicine that we go to our doctor and say, I have a headache, I have a cold, right? And so that's conventional medicine. If I had to compare conventional medicine and functional medicine, in conventional medicine, we are trained to ask, what is the diagnosis? What medication treats it? In functional medicine, we ask, why? Why is the body showing the symptom? Because symptoms are not random. They are signals. In functional medicine, we believe that every symptom that happens is because either there is a deficiency in the body or a toxicity. So let's find the deficiencies. Let's find the toxicities. Bring the body back to a balance, and guess what? A lot of symptoms go away, and many diseases get better and improve. So that's what functional medicine is in a nutshell. And me not really liking to prescribe a lot of medications with functional medicine, I don't really have to prescribe a lot of medications. We usually use vitamins and herbals. We do prescribe medications too until we have to. So when we ask ourselves the question, what is it? Is it hormonal? There's a change to the tissue in the body. There's a muscle change. What is it, right? And that's how I got myself into focusing on hormones. I love focusing on the sex hormones, the estrogen, progesterone, and testosterone, and also the thyroid, insulin, and cortisol. We have a lot of hormones in our body, but those are the biggest six hormones that I really like to focus on and see how I can bring them back to a balance. So today we are talking about urinary incontinence, pelvic floor changes, and we are talking about the fact that half of the women are affected. How about men? Are they affected too? Yeah. Well, this is not just a woman's issue. Up to 1 in 5 older men experience bladder symptoms, especially as they get older. They get any prostate changes, the size of the prostate, or sometimes they get prostate surgery. So just like in women, the pelvic floor muscle is part of the story. How many of you know of a husband or a significant other that's dealing with these pelvic changes? Yeah, I'm sure everyone's thinking about someone in their lives that they know. So how common is this problem? So when you put it all together, up to 50% of women and up to 20% of men are dealing with some sort of bladder symptoms. And when you think about it, that's a lot of people. And the truth is that it increases with age. It increases with age. So we talk about bladder symptoms and bladder issues. What are we actually talking about? Let's talk about different bladder issues, because symptoms don't look the same for everyone. Have you ever had that urgent feeling that you gotta go right now? Yeah. Sometimes it's urgency, that sudden feeling that you just have to go right now. And sometimes, you don't make it in time. Sometimes it's frequency. You're like, nothing has changed in my lifestyle. I drink the same amount of fluid, but now I just have to go more frequently, right? So that's frequency. And sometimes it's a leakage when we cough, we sneeze, we laugh, we jump, we just leak a little bit. And the other problem is that many women experience a lot of repeated infections, the urinary tract infections. We call them UTIs. For some reason, UTIs happen more often after menopause. So that's some sort of bladder issue that we are dealing with, right? And these symptoms don't always look the same for everyone. They look a little bit different. But we are going to talk about different bladder issues because it can look a little bit different in different people. All right. The first is stress incontinence. Stress incontinence doesn't mean the emotional stress. It's the pressure on the bladder that causes leaking when you're coughing, sneezing, laughing. So that's the stress incontinence. And that's very, very common, actually. That stress incontinence is very common. The second is the urge incontinence, that sudden feeling that you have to go right now, and sometimes you don't make it in time. That's stress incontinence. And many women have a combination of both. They leak when you sneeze, and they also have that urgency. So that's mixed incontinence. So we have 3 types of bladder dysfunction. How many of you have ever adjusted your day because of your bladder? Many people adjust their days just because of bladder issues. And it's not just about the bladder. It affects how women live their daily lives. So what they end up doing is that they start planning their days around bathrooms. They wear pads just in case. They avoid activities they used to love. They love to travel, go to social events, do exercise, but now they're avoiding those activities because of bladder issues. And they go through repeated rounds of antibiotics. Over time, this changes how you live, right? And this isn't just a physical issue. It's a quality of life issue when you think about it. Because now it's affecting the quality of your lives every single day. And many women don't even realize how much they have adjusted their lives until they don't have to. Why this matters? Because it's very common, but it's not normal. It is not normal. What most providers say when you have this problem? What do you usually hear when you tell your provider that I have leakage or urgency? What do they blame it on? Old age. Yep, exactly. Next. This is what I hear all the time. People are told it's just aging. This happens after childbirth, so that's normal. That what menopause does, right? So what happens, instead of getting help, I see a lot of people just adjust their lives and they feel embarrassed. But this is a medical issue, not a personal failure. No one should be embarrassed because of what's happening in their body. Does any of this sound familiar so far? Yeah. But I just want you to know that you have options. You don't have to deal with this. You don't have to adjust your lives. You have options. What are some other symptoms that are related to the bladder and the pelvic floor muscle that people don't connect that they're related? Any other symptoms you can think besides, the leakage when we are talking about the bladder issues? Yeah, right there. So with the bladder, we get the urgency, frequency, leakage. Nighttime urination. Does it happen to you that in the middle of the night you wake up and you're like, I just go to the bathroom because I'm awake. But then you're like, I didn't even have a full bladder. Why did I feel like I have to go to the bathroom? So that's the nighttime urination. And when it affects the pelvic floor, you feel that feeling of pressure and heaviness. You have discomfort with intimacy. It can cause constipation. That's crazy, right? It can cause constipation. And also incomplete emptying. So you're unable to empty your bladder when you urinate. So now the question becomes, why is this happening? Why is this happening? What happens with menopause? What are the hormones that our ovaries are like, I'm retired, I'm not going to do the job anymore? Because ovaries work for 30 plus years in most cases, right? Now they're retiring, so they're not going to produce any more estrogen and progesterone. So what happens is that in menopause, our estrogen levels go down. Our ovaries do not produce any more estrogen. And we know that estrogen doesn't just affect the periods. Estrogen is not just a sex hormone or a hormone that we need to have our cycles. It's a life hormone. We have receptors, estrogen receptors, everywhere in our body. We have estrogen receptors in our brains. When we go through menopause, a lot of us get brain fog because we have all those receptors in our brain. We have estrogen receptors in our skin. That's why after menopause, collagen production down, and we get saggy skin, dry skin, itchy ears, itchy eyes, itchy skin, because of all those estrogen receptors. We have estrogen receptors in our gut, and then we see constipation happens after menopause. So we also have a lot of estrogen receptors in the bladder and the pelvic floor muscle. So estrogen goes down, it affects the bladder because we have a lot of estrogen receptors. It affects the urethra. I'm still on the previous slide. It affects the urethra, the vaginal tissue, and also the pelvic floor muscle. Because it's the estrogen that keeps these tissues strong, flexible, and coordinated and supported. So that's why when estrogen goes down, we feel urgency, frequency, urination, right? It's not just aging. This is a hormonal change. We're talking about hormonal change here, so it's not just aging. Next slide. Why estrogen matters? Because we know estrogen keeps the tissue thick, elastic, moist, and protected. The picture on your left shows how estrogen keeps the tissue thick, elastic, and well protected. Look at all those blood supplies around the vaginal lining. It's pretty thick. It's a really nice barrier, and a lot of blood supplies around the tissue. It acts like a natural shield that keeps the moisture in, the bacteria out, and muscles very supported. But after menopause, when estrogen declines, tissue become thinner. Look at the other picture. Now the tissue is thinner, drier, and more fragile. And it's not just about comfort now, it's about protection. Because that thinner tissue is easier to irritate, it's easier to tear, and it's easier for the bacteria to enter the body because the barrier is very thin. We call this the genitourinary syndrome of menopause. But you don't have to know the medical term to get the message. This is the message. Estrogen keeps your system together. When estrogen drops, symptoms rise. So it's the estrogen that keeps the whole system together. Next slide. So we talked about women going through a lot of UTIs. What are they being told when they get UTIs? What do you usually hear when you say, I have a UTI problem? Drink more water, yeah. Or they're told, oh, it's bad luck, or it's a hygiene problem. But we know that it's not a hygiene problem, right? It's not about cleanliness. It's a hormonal issue that causes this. When estrogen drops, bladder and the urethra, look at the bladder and the urethra, they lose their protective lining. It's a thinner lining. That lining normally acts like a barrier that doesn't allow bacteria from sticking and traveling upward. Now, that barrier is kind of gone. It's very thin. And without that protection, now bacteria can enter, stick, and travel upward and cause infections. This is why women feel they're stuck in a cycle. They're stuck in a cycle of, next slide, because there is a weaker barrier. They get infections, we treat the infection, but because we just chase that bacteria, that infection, we didn't fix the issue, which is the lining. Now another infection happens again. So we just chase this around. Infection, antibiotics, go back to another infection, right? This is a cycle that a lot of women are stuck in. So this is how estrogen affects the UTIs, the cause of UTIs. How about the pelvic floor muscle? Next. The pelvic floor muscle is a group of muscles. You see that muscle down there? They're working together in the background to support the bladder on the left, the uterus and the vagina, and also the colon. So all those organs are supported by that pelvic floor muscle, and that muscle is very, very hormone sensitive. With the estrogen, that muscle is very reactive, strong, and supportive. So without estrogen, this muscle loses the strength of the muscle. And that's why a lot of women start noticing their symptoms. They feel that urgency and they're uncomfortable. It's uncontrollable urgencies and that heavy, dragging feeling that they feel. So far, next slide. We talked about weakness happens, there is poor coordination and less control. So how do we make this muscle stronger? We go to the gym to exercise a lot of different muscles in our body, our biceps, triceps, quads, calves, calf muscle. But this muscle, the pelvic muscle, how do we make it stronger? What do we do? What are you being told by your providers to do? Kegels. Who have heard of Kegels before? Who's tried Kegels before? What is Kegel? Is it that feeling, that exercise, they're like, oh, just think that you're urinating and midstream you just pause it and control your peeing, right? Or is it that exercise that your doctor tells you to do but never explains how to do? And if you're doing it, you're like, am I doing it correctly? Is it even effective? Right? So that's the key. Should we exercise some Kegel exercise right now? Should we try them together? All right. Imagine you're urinating and just relax your muscles, okay? You're in the middle of urination. Now contract all the muscles and hold your urine really, really hard. Okay, hold it, contract that muscle and relax. So you just did one Kegel exercise right now. And you need to contract it really hard in order to activate those muscles. So that's Kegel exercise. Okay, next slide. So yes, most women are told to just do Kegels, but many don't know if they are doing them correctly or they don't even know how to do them. And there is a mind-body connection. So you have to mentally, connect your mind to your body and start doing the exercise. What happens after a minute? You start thinking about something else, you're daydreaming, and then before you know, you're not doing any exercise down there. So it's definitely a mind-body connection. You hear the echo? So in other parts of the body, you would never expect a weak muscle to just heal without proper rehabilitation, right? So I think the pelvic floor deserves to get the right rehabilitation just like a knee or shoulder. And today we actually have technology that can help rehab those muscles. And it's really comfortable, it's safe, and it doesn't even need any invasive therapy. I'll show you what it looks like in a video in a few minutes. But first, let's talk about what happens when someone goes to a doctor with these complaints. The typical approach is, if you go next slide, please, pads to manage leakage, medications to relax the bladder, antibiotics for repeated infections, Kegel exercises we just talked about, or surgery in some cases. And for some people, this can actually help, but a lot of women don't really get help and they feel stuck. Do you know why we don't get a lot of help from all these different approaches? What's the problem? Most doctors are men and they never experience these issues. That's one, yeah, for sure. Yeah. Next slide. It's because we are managing the problem. We are managing the symptom. We are not really fixing the issue. What is the issue? Hormonal change, we don't have hormones, and that muscle weakness, right? That's the problem, but we don't really go after it. What if we looked at this a little bit differently? Instead of managing it with pads and medications and repeated antibiotics, we looked at it a little bit differently. The most effective treatment is not just one approach. It's a layered approach. That's how we can heal the body from inside and the outside. And a lot of women just need one layer. So let's talk about what actually works. First, hormones. We talked about estrogen. So we know that estrogen affects the bladder, the urethra, and the vaginal tissue. So some people, we just need to support their hormones, to give them a little bit of hormones for that, to bring that muscle stronger and to give it some estrogen. The second is the pelvic floor. These are the muscles that support the bladder. And the third is that tissue support. And let's just talk about each one of those approaches a little bit in details. Next slide. So hormonal support is done by something very simple. It's a low-dose estrogen therapy that has a local absorption. It doesn't have systemic absorption. What's the difference between a systemic absorption and a local absorption or local therapy? Think about someone who has pneumonia, right? They go to their doctor because of pneumonia. Most likely they get an oral antibiotics or an IV antibiotics. When that medication enters their body, it will go through the whole system and find the source of infection and kill the infection. So that's a systemic approach. Now let's think about someone who has a cut on their arm, and the cut is a little bit irritated and red, and they put Neosporin on it. That Neosporin doesn't go into the system, right? It's just treating that local area. So when we talk about low-dose estrogen therapy, we are talking about a very low-dose estrogen that is very, very safe, and about 99% of women qualify to be on this vaginal cream. It's so safe that the 99-year-old grandma in the corner of a skilled nursing facility can use it, and they should use it, because we don't want that grandma to die from urinary tract infection, which we spend millions of dollars to treat those infections and chase them. It's so safe that women with a history of personal or family history of breast cancer can use it, right? And I believe that any woman after menopause, they should talk to their doctors and use this cream. If you need some help deciding if you qualify or how to use it, come and talk to me. I'm offering free consultations. And also, Dr. Patel here. Dr. Patel, can you please stand up right there? Ask Dr. Patel, because she is giving these medications almost every day, and she goes over the instructions with the patients. And just ask one of us after this talk about if you qualify, so you can ask your doctor for a prescription, because this local estrogen therapy can do magic. Next slide. Now, when it comes to strengthening the pelvic floor, most people are told to do Kegels. We talked about it. But the problem is that many people don't know how to do them, or if they are doing them correctly. And even when they do, it can take a long time to see results, right? So over the last many years, new technology have been developed to help strengthen this pelvic floor muscle. And these devices are available, and they use high-intensity electromagnetic energy to induce that pelvic contraction for you. This kind of chairs are non-invasive, and it allows patients to remain fully clothed, and you just sit on a chair. The chair would stimulate your pelvic floor muscle. It will do the contractions for you. And in one session, you will get over 11,000 Kegels in just one single session. It would probably take you like a whole day to do probably 1,000 Kegels, right? If you just put your mind and body connection. You can do 1,000, but this machine will do 11,000 Kegels for you in 28 minutes. And the good news is that there is no pain, there's no downtime, and the sessions are very simple. Who got to demo this device today? Okay, you did? Was it painful? Tapping, right? You felt this tapping on the bottom of your pelvic floor? Yeah. How about you? What did you think? Comfortable? Yeah. So some benefits of this kind of therapy is that it helps with leakage, with urgency, the strength of the muscle. It helps with erectile dysfunction in men. I always ask my men patients, do you prefer the blue pill or the blue chair? Because the blue pill, you gotta take it every time and for the rest of your life. But the blue chair, you need 6 sessions, and then after that, you just need maintenance sessions. It also helps with sexual wellness, both men and women. It improves the sexual wellness. It also helps with lower back pain because the pelvic muscle, the pelvic floor muscle, is connected to the back, right? So when you strengthen that muscle, it helps with lower back pain. And more importantly, it helps with confidence. Now you can resume your activities. You can enjoy your vacations. You can go to your social events without worrying about what color pants I'm gonna wear or I need to wear pads, right? Confidence is back. Sometimes it's just easier to see than explain it. So I want to show you a video. Next slide. What do you guys think? There's nothing invasive. It's easy, you just sit on it, right?
It's getting up 4 or 5 times a night to go to the bathroom. So it was
Go ahead. Yeah, go ahead.
4 or 5 times a night to go to the bathroom. So it was interrupting my sleep. I was tired all the time.
We used to do jump rope competitions. I couldn't jump rope. I couldn't do double leg jump. I had to do single leg. And it started there.
Well, it's age, pushing 50, and having kids. It's just the way that it is. The equipment gets weak.
I would run to the bathroom. I would leak. It's freeing, very freeing. To be able to just do what you want to do again.
Better control over when I do have a contraction. I can handle it better.
If I ran across somebody who complained about the problem that I had, or even something more severe, I would actually say, hey, I have a doctor. All you have to do is sit in a chair 6 times. Sounds a little strange, and you don't even have to get undressed, and it works. So I would absolutely recommend it.
It's awesome.
Next slide. So basically, this is a non-invasive therapy that treats the entire pelvic floor. It gives you thousands of contractions in 28 minutes. You don't need to undress. It's FDA cleared for urinary incontinence, 95% satisfaction, and it's a in and out procedure. You walk in, you walk out, and continue with your day. And that's all I had for you today. Next slide. It's not covered by insurance. The cost is tailored to every individual's need about how many sessions they need. So I'm more than happy to do a one-on-one consultation with you to see how many sessions you need and then come up with the average price that you just need to pay for this. But overall, in a year, the money that's being spent on pads, it's way, way more than what you will pay to get the right treatment and strengthen the muscle that not only helps with urinary incontinence, but also sexual wellness and everything else. Yes. No, it's everywhere in the States. Oh, you mean the insurance? Do I consult? No, I'm only licensed in California. Yes. Good question. So usually do 6 sessions, and it's usually about 1 to 2 sessions a week. So you can finish the whole therapy in 3 to 6 weeks. And after that, you need a maintenance session every 3, 4, 5 months. Everyone is just a little bit different. Whenever they feel like, oh yeah, I think that urgency is coming back, they just come, get 1 session, and they're good for months again. Yes. Men? Yes. Yeah. It does the same thing for men. Not only it helps with that erectile dysfunction problem with older men with after prostate surgery and prostate changes, 72% in improvement in ED, erectile dysfunction. But it also helps with the lower back pain. Have you seen those weightlifters that they're so bulky and big, and they're lifting weights, and all of a sudden you see they urinate? The reason is that, think of the abdominal cavity like a box. So you go to the gym, you can exercise all these muscles in the in your abdominal cavity, all your back muscles, but the pelvic floor muscle, you can't really exercise it. So what happens even with people that go to the gym regularly, they cannot work that muscle, they cannot work out that muscle. So that muscle gets weak in almost everyone. We should put one in the gym. Yes. Did you have a question? Any other questions? You come to my office to do it. I'm here in Laguna Hills. And yes, you can come to the office. You can come for a consult first. Dr. Trin asked me to offer free consultations today, and I said, sure. I always say yes to Dr. Trin. So I am offering free, because next time he won't invite me if I say no. So consultations are free. Come in, see if you qualify, how many sessions you need, and then it's done in the office. You can really come during your lunch break if you're working. Any other questions? All right. Perfect. Thank you so much, everyone.